Welcome to FUNC YOU UP, the podcast that gives you the best of functional medicine, nutrition, and wellness in 8 minutes or less.
Hello, everyone, and welcome back to FUNC YOU UP. This is Michelle Miller, clinical nutritionist.
And this is Diana Orchant, functional medicine registered dietitian.
Today's episode, we're going to talk a little bit about this little itty bitty thing called yeast and why this can wreak havoc on our body. So Diana, start us out. I know we're going to talk about, this is a really broad topic and it's very complex, and we're just going to break down some of the basics of it. So the tricky part of this is we're going to kind of talk about this general concept of like yeast, candida, and like fungal strands, but kind of break down like what is this, or like what causes it, and like where do people, how do people even know they have it?
Yeah, I think we hear this all the time. I have Candida, or I have yeast overgrowth, or even I just have recurring yeast infections, or whatever it is. And what does that really mean? So yeast really is actually somewhat important to have some of it. So it keeps our digestive system healthy and balanced, but it really depends on the amount. So the right amount in our body is what actually helps our immune system, and it's part of a healthy mix of bacteria in our gut. The thing about it, the problem that occurs is when we have way too much, and that's why we call it yeast overgrowth.
Right.
And it can usually be really in any part of the body, but it's usually systemic and arises from the gut, and that's where a lot of the problems happen.
And so sometimes we will have patients that know that they have yeast, whether they have manifestations on the skin, or sometimes they'll have oral manifestations. That's like the oral thrush. Sometimes you can just see coatings on the tongue. And also sometimes people just know they have fungal issues. Maybe they have athlete's foot. Maybe they've had other, like fungal skin issues. Yeast infections are obviously going to be very common, but we've even seen athletes or overweight individuals that are getting yeast issues at different, in between the elbows or behind the knees, different parts where there's, not a lot of air getting to the skin. And so one of the things that we see a lot of with the stool testing that we do is a lot of candida or fungal strands, yeast strands that are coming out through the stool samples. And that's really where we can tell, okay, we know this is in the gut, and we know that this can be becoming a systemic issue. And what's so crazy is like the symptoms that can be caused by yeast overgrowth or candida overgrowth are so widespread, even though we're only picking up that yeast in the gut or in the vaginal lining. So talk a little bit about kind of how widespread these symptoms are.
Yeah, it's really crazy. We see things from, chronic fatigue and low energy to decreased libido, and a lot of digestive issues, bloating, gas, diarrhea, constipation, this umbrella term of IBS, cravings for foods that are very rich in carbohydrates or yeast. We also really frequently see rectal itching, which a lot of people don't talk about, but is really common with yeast overgrowth. Also, another common symptom would be yeast infections that are reoccurring.
Right.
Again, that's kind of, I guess, more of an obvious symptom, but we can see it affect the thyroid. We can see it affect mood. Sometimes depression can stem from yeast overgrowth, inability to concentrate, almost like these ADHD type of symptoms. All the way to different rashes on the skin, such as eczema and psoriasis. And I think that wraps up a lot of different symptoms.
Yeah, I think some of the things that we learned while we got into practice was how much yeast and candida can inhibit weight loss. So we'll have so many clients come to see us who are looking to lose a little bit of weight. Maybe they have some other health goals at the same time. But until we get rid of that yeast, it's like the weight doesn't really budge, which can be an extremely frustrating experience for a patient. I've seen in those cases, it almost feels like they are swollen or they're like retaining water. They feel really puffy. And once we get that yeast kind of cleared out of their system, rebalance that terrain, that environment, kind of creating an internal environment where it's not as desirable for the yeast to thrive, only then can they really lose weight and their body starts to kind of regain its optimal function.
Yeah, that's true. I think a lot of people don't realize that can inhibit weight loss. So before we dive into what we would do about it, I think it's kind of important to understand, how do we get here? How did yeast start overgrowing in our bodies? And there are so many different factors.
Yes. So first, let's just go back to that concept I just mentioned of we have this internal terrain, right? And it's this constant balance in our body of maintaining the right amount of good and not having too much of the bad. And this could be anything from the pH level of our internal environment, but also things like what our diet is doing. And if we're feeding our body with good foods, or if we're feeding our body with inflammatory foods. Even in the gut environment, what is the bacteria balance that's going on in the gut microbiome? There's a big reason why probiotics are used in a lot of yeast protocols or Candida protocols, and it's because that good bacteria can really set a beautiful tone for the internal terrain. And when I say internal terrain, I mean everything from, the oral terrain, the GI terrain, the vaginal terrain, it's the skin terrain. Like there's, our whole body has to be maintaining this constant balance for us to be avoiding from, certain bacteria or certain yeast or candida to be kind of like growing in that environment.
Yeah, and then some of the other things that we often see specific to diet are a diet that's really high in refined carbohydrates, processed foods, and sugar. And what's ironic is that the yeast thrive off of sugar. And it's difficult because to get rid of the yeast, I was just talking to someone about this earlier, to get rid of the yeast, you have to get rid of all the sugar so that it can not thrive, but your body wants to eat that sugar because naturally you want to feed the yeast that's in your body. So it's not easy. And another thing we see is frequent use of antibiotics. As Michelle's saying, it disrupts that normal terrain, that normal healthy balance between a lot of the healthy bugs in our gut. And also the frequent use of antibiotics can just encourage more pathogenic bacteria and yeast to grow.
That's a really good point. So yeah, maybe let's just talk a minute about the things we'll comment, like the patient's history when they're walking in the door and they have yeast. I mean, it's not unusual to see someone who's been on a lot of antibiotics or something like Accutane that has messed up their gut or GI system. Even things like oral contraceptive pills, we've seen that kind of mess up the internal pH of the body. I think there's a lot of medications, even things like chronic antacid use or PPI use. We can see that change the pH of the internal GI system and how that can influence a more desirable environment for yeast to thrive. And then, I guess going into really any medication that would affect your GI system, whether it is an over-the-counter or it is something that is prescribed, you're altering that environment in one way or the other. Unless it's enhancing your digestive system, it might be making it a little bit more vulnerable.
Yeah, and something I think a lot of people don't think of, especially when yeast is very pesky. And as I've said, it's hard.
Very resilient.
Yeah, it's very resilient and it'll fight back.
Yeah.
And so a lot of people that's why, people get these recurring yeast infections. That's why it's hard to kill off these yeast strands in our body. But one thing that we actually have seen that a lot of individuals overlook is that if they can't get rid of it and they're kind of doing everything right, following the protocol, is that yeast does spread from different individuals. And so a lot of times when we can't fix it in the individual, we have to start looking, okay, is the partner carrying some strands of yeast? Because oftentimes both individuals might actually be carrying it. And that's where some of the problems lie.
Yes, absolutely. And I've even read stories about pets having yeast issues and having that, it's a very, very good point. So if someone is suspicious that they have a yeast issue, they are identifying with a lot of these symptoms, what would be, obviously we talked about stool testing, we love our stool testing, and that is really helpful. But what are some kind of beginning steps just with the diet? Because I know this part can be really overwhelming.
Yeah, I think, people often Google the Candida diet, anti-yeast protocols, and it can be extremely overwhelming. The first thing to do is kind of look at your diet and figure out what are you eating right now that could be feeding the yeast. So for some, that's, they're eating a lot of processed sugar, they're drinking juice or soda, and all these foods, candy, cookies, bread.
Alcohol's a big one.
Alcohol, exactly, like especially beer, there's so much yeast.
Right.
So these, and alcohol is also disrupting our microbiome as well, making the yeast, making more room for the yeast to even grow.
Yeah.
So I think first of all, kind of looking at the diet and then changing it and figuring out, okay, what can we, I don't even like to say what can we remove, more of what can we add in so that these other foods are crowded out. So it's not, and people always say like, can I have fruit? And yes, it's not, you can't go overboard with the fruit, but because at the end of the day, it breaks down to sugar and the yeast is craving that, which again makes us crave it too. But that's kind of the first step, is looking at the diet and bringing in a lot of times more vegetables and healthy proteins to crowd out some of that sugar.
And I know not all nutritionists believe this mindset, but I'm definitely the nutritionist that is going to say also really be careful about how much fermented foods or kombucha or like even apple cider vinegar you're using during this phase when you're just trying to clean the yeast out. I think those fermented foods and things like that are really helpful once you have a good healthy terrain of the GI environment, when that yeast has been cleared out. But while that yeast is still present, I am not a fan of still using those components. So just put that on the record. But I also want to say a lot about, anti-Candida diets can be extremely daunting. And my personal viewpoint is that I don't think we're really designed to be able to get rid of Candida and yeast just through diet alone. I think that's where the beautiful element of like antifungal and yeast and anti-Candida herbs can come into play.
Yeah, there are so many wonderful herbs that can really assist, that have pretty much no side effects. And they can range from caprylic acid, uva ursi, cat's claw, paw d'arco. There's plenty of wonderful herbs that can really help support this process, so that you can have a little bit of fruit, you can have a little bit of sugar, and it'll be okay, because these are going to help kind of step up your game, as opposed to like kind of going into this fight alone and just trying to manage it through diet. You need something else that's actually going to attack the yeast while you're, pulling your weight and watching your diet.
I couldn't have said it better. I totally agree. I think as Diana was explaining, when you are craving sugar because this yeast wants to get fed, and then you're trying to cut sugar out of your diet, you think you're supposed to just go off of willpower, you will make yourself crazy. So it really is helpful to kind of utilize some of those antimicrobial herbs in the beginning. Sometimes we'll also recommend things like enzymes or probiotics, or even a little bit of like a betaine HCl type of supplement to help out with this process of just strengthening the digestive process and making sure you're having good regular bowel movements as all of this is kind of dying off. But the unfortunate thing is, as yeast is getting killed off, sometimes there can be a little bit of a die-off process. So that's why I do think if you feel like you have a really massive Candida or yeast issue, that you want to try to do this with a trained practitioner, so that, we can help care for your needs during this process.
Absolutely. And I was just thinking, as I said, there are no side effects. It's not a direct side effect per se. It's more of a die-off effect, that if you do have a ton of yeast overgrowth, and this goes for getting rid of any bacteria in your body or any pathogenic strands, you will likely feel some sort of almost a little bit of withdrawal. I mean, you could feel withdrawal just from going off of sugar alone, let alone killing off all of the yeast.
Yes, absolutely. Absolutely. Yeah. And I will say too, working with our functional medicine doctors, sometimes we do have to up the ante a little bit and go into the prescription world. Some doctors will use things like diflucan. Some doctors will use nystatin. I think a big issue we've seen with clients is clients with chronic yeast or candida issues, they almost become like resistant to diflucan. Like they've taken it so many times, it feels like it's not even that effective anymore. So that worries me too. That's when we know we really have to pull out all the essential oils and herbals and kind of all of these other natural medicines that we can use to support the body, and really pair that with diet and lifestyle. Make sure you're sweating, make sure you're drinking enough water, make sure you're sleeping, so that you can kind of heal the body from the inside out.
Absolutely. And I think it's important that we don't just spot treat it. So whether it's giving yourself some monostat or putting a little bit of Lamisil on your athlete's foot, it's more important to figure out, okay, what's going on. And that's again where this wonderful stool test comes in, to actually see that it's more systemic for a lot of patients. But yeah, just not just kind of giving a pill for an ill for this, and really figuring it out and treating the root cause.
Absolutely. Absolutely. Yes. And if you've ever dealt with brain fog or any side effects or issues from yeast, you will know how much better your quality of life is once that is taken care of. So, well, we hope that this was valuable information for you today. And thank you again for being such loyal listeners to the FUNC YOU UP podcast. We love to hear from you. And if you want to leave us any comments, any suggestions about future episodes, we'd love to hear that too.
You can reach out to us at funkyouup@physiologicnyc.com or via our Instagram at physiologicnyc.
We'll see you next time.
You've been listening to Funk You Up. Be sure to like, review, and subscribe for more daily tips on living well.